Okay, let's think about the future of health for a second. Imagine not needing appointments for basic checks, but having tech just woven into your life, keeping track of things.
Mhm.
What if your body could sort of continuously signal how it's doing without you even noticing? It's a pretty powerful idea, right? And today, we're going deep into where a lot of this started, wearable health monitoring systems, or WHMS.
Yeah, and what's really fascinating, I think, is that this isn't some brand new concept from the last couple of years. We're actually looking at a really comprehensive survey paper from way back in
Alex
2012.
9, wow, that's quite a while ago in tech terms.
Exactly. It's called a Survey on Wearable Sensor-Based Systems for Health Monitoring and Prognosis by Alexandros Pantelopoulos and Nikolaos Bourbakis. And it gives us amazing foundational look at the promise, but also the big challenges that were already popping up years before, your average fitness tracker became common. What's really insightful is how the main drivers they identified back then, the big pressures, are still shaping healthcare today. Shows these are persistent, real problems.
Right, still relevant.
Yeah. So, okay, our mission for this deep dive is to explore why these systems emerged, what the actual tech building blocks are, peek at the kind of innovation happening back then, and really importantly, understand the hurdles that still needed clearing for this tech to truly change healthcare. Basically, we're giving you a shortcut to understanding this whole field, starting from a key early source. So let's start with the why. Why did wearable health monitoring get so much traction, especially around 2009 when this paper came out?
Well, the authors point to two huge factors. First, rising healthcare costs. It seems like a constant, doesn't it?
Tell me about it.
And second, the undeniable fact of an aging global population. More older people needing potentially more care.
Okay, so it's framed as this really necessary shift then, moving away from just hospitals and clinics. Exactly, moving towards monitoring patients continuously, supporting them right in their own homes, their own environments. If you think about the big picture, it's way more than just cool gadgets. The core idea, as the paper puts it, is enabling proactive personal health management and ubiquitous monitoring.
Proactive, meaning catching things early.
Precisely. Think about low-cost, wearable, unobtrusive solutions for continuous all day in any place. Health, mental, and activity status monitoring. And the applications are really significant. Managing chronic diseases like diabetes or heart conditions, helping older people live independently longer, supporting post-op recovery at home, even assisting people with special needs. It's really about transforming healthcare access and moving towards prevention and better management, not just treating sickness when it happens. It's a societal level shift, potentially.
That makes a lot of sense. So what actually goes into one of these systems? What are the components?
Right, the nuts and bolts. The paper breaks it down pretty clearly. You've got various types of miniature sensors, obviously, to capture the biological signals.
Okay, tiny sensors. What else?
Then you need transmission modules,
Right.
ways to send the data the sensors collect. And processing capabilities, basically the brains to make sense of the data, maybe do some initial analysis right there on the device.
It sounds like a little mini ecosystem on your body.
Pretty much. And these sensors, the biosensors, they were already measuring some really key things back then. Heart rate, blood pressure, body and skin temperature, oxygen saturation, SpO2.
SpO2, that's the blood oxygen level, right?
Mm.
Became very familiar during the pandemic.
Exactly. Also respiration rate, how fast you're breathing, and even ECG, the electrocardiogram, which maps your heart's electrical activity. Quite sophisticated stuff.
But putting all that tech onto a person day in, day out,
Right.
that must be incredibly challenging from a design perspective.
Oh, absolutely. And this raises a really important point the paper stresses. It's not just about the tech working in a lab. It has to work on a person. You have strict medical criteria for accuracy and safety, obviously, but that's combined with ergonomic constraints. It has to be comfortable, not get in the way.
Can't be a giant clunky box.
Right. And you've got significant hardware resource limitations. Battery life is a huge one. Size, weight.
So designers are juggling all these things, like make it tiny, make it light, make it comfortable, don't use much power, make sure it's secure. Oh, and make it affordable.
You got it. Plus, worries about radiation, aesthetics, will people actually wear it? Data security is massive, too. You're dealing with very private information. That's why the authors say very clearly there is no single ideal design. What works best depends entirely on what the device is for. A hospital monitor has different needs than a daily fitness tracker.
Okay, that makes sense. So you've got these sensors collecting data. How does that data actually get anywhere useful? How do they communicate?
Good question. The paper outlines two main communication paths. First, you need the sensors themselves, if there are multiple ones spread out, to talk to some kind of central hub on the wearable system. Think sensors on your chest talking to a device on your wrist.
Right, short range within the system itself.
Exactly. That's often called a body area network, or BAN. Then second, the whole wearable system needs to send the collected, maybe processed data somewhere else, like to a doctor's monitoring station, or maybe just to your smartphone for you to see.
So short range within the band, and then potentially longer range out to the wider world.
Precisely. And understanding how both of those work is pretty crucial.
Let's start with the short range, the band. Wires seem like a non-starter for something you wear all day.
Definitely. Wires hinder movement. They can break easily. So wireless is much better. The paper mentions some cool ideas even then, like using conductive yarns actually woven into flexible, smart textile clothing.
So the clothes themselves become the wires.
Sort of, yeah. A very elegant way to connect things without separate wires. Another approach is using separate autonomous sensor nodes, tiny sensors that communicate wirelessly, often in what's called a star topology.
Star topology, like everything talks to one central point.
Exactly. All the little sensor nodes report back to a central device, which could be a PDA back then, or more likely a smartphone now.
Okay, so for that wireless short-range communication, what were the main technologies being used? The paper mentions a couple of familiar names.
Right. The big ones discussed are IEE 802.15.1, which we all know as Bluetooth, and 802.15.4, which is the basis for Zigbee.
Zigbee, I know that one from smart home devices.
Right.
Low power, right?
Exactly. Zigbee is designed for low-cost, low data rate applications. It doesn't need to stream video, just send small packets of sensor data. And its big advantage is incredible battery life. The paper mentions multi-month to multi-year battery life.
Wow, years.
Potentially for very low power sensors. It has a decent range too, about 75 meters, and supports different network setups like star, tree, or mesh. And crucially for health data, it uses AES encryption with 128-bit keys to keep the messages secure.
Okay, so Zigbee for ultra-low power. What about Bluetooth?
Bluetooth is also described as a low power and low cost RF standard. It uses something called frequency hopping to avoid interference, which is pretty clever. It can handle higher data rates than Zigbee, up to 3 megabits per second.
Faster, but maybe uses more power.
Generally, yes. Its range can technically go up to 100 meters, but 10 meters is more typical for standard Bluetooth power classes. The basic setup is a Piconet, connecting devices to a master. It uses safer plus encryption.
But the paper mentions a potential issue with Bluetooth security.
It does. It notes that the Bluetooth framework is often found to be vulnerable to possible attacks and risks. That's a serious concern for sensitive health info.
Definitely.
Though they also briefly mention Bluetooth Low Energy, or BLE, which was emerging then, designed specifically for ultra-low power devices, making it very suitable for healthcare and fitness.
So Bluetooth and Zigbee were the main contenders. Were there others?
The paper mentions a few alternatives, but finds them less suitable for bands at the time. RDA infrared needs line of sight, so that's impractical.
Like old TV remotes, yeah.
Exactly. MICS, the Medical Implant Communication Service, is super low power, but really designed for implants like pacemakers, and there weren't many commercial solutions for external wearables. And UWB, ultra-wideband, was seen as too complex for these needs back then.
So even with Bluetooth and Zigbee, there were still gaps.
Apparently so. The paper states that these existing standards often fail to address the requirements of bands fully. Issues like interference, security worries, the physical size of the radio modules, or just power consumption meant they weren't perfectly optimized for being worn on the body.
Which leads to a new standard being developed.
Precisely. The paper points towards the future with IEE 802.15.6. This was specifically planned to be optimized for low-power devices and operation on, in or around the human body.
Tailor-made for wearables.
Exactly. It aimed for scalable data rates, very short range, just 2 to 5 meters max support for up to 100 devices in a network, and crucially, ultra-low power consumption, targeting just 0.1 to 1 milliwatt.
That really shows they knew a dedicated standard was needed, specifically for the body.
It does. Foresight into the unique challenges of this environment.
Okay, this is fascinating. Let's shift gears now to the actual systems people were building. The paper talks about research prototypes and commercial systems, right?
Yes, it gives some really concrete examples, which helps bring all this theory to life. You can see the ingenuity and the different ways people were trying to solve these problems.
Let's hear about some of the research prototypes. What stood out?
Well, under microcontroller or custom platforms, there was LiveNet from MIT, described as a flexible distributed mobile platform for long-term monitoring. It had a biosense board measuring ECG, EMG,
EMG is muscle activity.
right, electrical activity of muscles, also galvanic skin response, and a 3D accelerometer for movement. They even did pilot studies monitoring soldiers in harsh environments and detecting Parkinson's symptoms automatically. Pretty advanced stuff.
Wow, yeah.
Then there was AMON, an EU project. This was a wrist-worn device measuring blood pressure, skin temp, SpO2, and ECG. The innovation was packing many miniaturized sensors into one device with real-time processing. Did it work well? They had some reliability and wearability issues during validation, which isn't surprising for early prototypes. But the paper notes the general idea of the device was very well received by the users. People wanted this kind of thing.
Okay, what about systems built into clothing? The smart textiles.
Ah, yes, that's a really interesting area. The My Heart project, another European one, aimed to tackle cardiovascular disease using smart clothes. They used tiny conductive wires knitted like normal textile yarns.
So the sensors and connections were just part of the fabric?
Exactly. That makes it very comfortable for the user and avoids needing lots of separate wireless modules stuck on the body. Very clever integration.
That does sound comfortable. Any others?
There was Wealthy, also European, a wearable garment recording biomechanical and physiological signals, again integrated into fabric. A key feature was its ability to filter out artifacts introduced in the measured signals by motion.
Dealing with noise from movement. That's a big challenge.
Huge. And Magic from Milan, a washable sensorized vest for ECG and respiration. It apparently had very good acquired signal quality and could even correctly identify atrial fibrillation episodes.
Washable too, that's practical.
Definitely. And one called SmartVest used various sensors in the garment, including ECG without needing conductive gel, and calculated blood pressure non-invasively, claiming signals free of baseline noise and motion artifacts.
Getting ECG without gel is a big step for long-term wear.
Absolutely. Then moving to moat-based bands networks of tiny sensor nodes. Code Blue from Harvard was a platform for monitoring multiple patients, maybe in a hospital setting or emergency response. Okay. It had custom boards for pulse oximetry, ECG, EMG, motion, and even an RF-based localization system to track where patients and staff were.
So tracking location too. But you mentioned something really surprising earlier, something about body heat.
Ah, yes. This one really stood out. The IMEC prototype from Belgium. They built a body heat-powered autonomous pulse oximeter.
Powered by body heat, no batteries.
Exactly. It used a wrist-worn, watch-sized thermoelectric generator that converted the wearer's body heat into electricity. It stored energy in a supercapacitor, not a battery.
That's incredible. A potential solution to the massive power problem.
A truly innovative approach, definitely. And finally, there were prototypes using commercial Bluetooth sensors and cell phones, which were becoming more capable.
Like what?
Healthcare from Microsoft Research used a standard Bluetooth pulse oximeter connected to a cell phone. The goal was monitoring users during sleep to detect sleep apnea.
Did it work?
The paper says it was completely successful in detecting mild and severe obstructive sleep apnea. Shows the power of combining existing sensors with smartphone processing.
Impressive.
And another one, Heart2Go, was a cell phone-based wearable platform for continuous ECG monitoring. What was really neat here was its use of artificial neural network-based machine learning schemes to adapt to the individual user's physiology.
So personalized AI, even back then.
Early steps, yeah. Learning what's normal for you to better spot anomalies. Very forward-thinking.
It's amazing the range of ideas being explored.
Yeah.
And these were mostly research projects, but you said there were commercial products already available too.
That's right. The paper points out this wasn't all just lab work. Things like fingertip pulse oximeters from Nonin and Philips were commercially available. Heart rate monitors from Polar and Omron, which many athletes used.
Yeah, I remember those chest straps.
Exactly. Also, devices like the Vivago wrist care watch for elderly monitoring, the SenseWear armband for activity and energy expenditure tracking, and even the Smart Shirt system from SenseTech, integrating sensors into apparel.
So the market was definitely starting to respond, even in 2009.
Absolutely. There was clear movement towards commercialization alongside the cutting-edge research.
Okay, so with all these prototypes and early products, how mature did the paper consider the field overall? Were these systems ready for prime time?
That's a key question the paper addresses in its maturity evaluation, and the short answer is not quite. None of the systems reviewed had reached what they defined as the maximum maturity level.
So promising, but still had a way to go.
Exactly. What's fascinating is that while the potential was obvious, there were common recurring issues that pointed clearly to where more work was needed. Interestingly, the systems that scored relatively high on maturity were often the ones based on smart textiles.
Because they were more comfortable and integrated?
Right. And also those that cleverly leveraged commercial cell phone devices and commercially available biosensors, like that Heart-to-Go example,
Why them?
probably because they were tapping into existing, somewhat proven tech, like phones and off-the-shelf sensors, and focusing on usability, reliability, and adaptability. It underlines how important the actual user experience and practicality were, even then.
That makes sense.
Yeah.
So what were the biggest roadblocks? What challenges needed solving for these systems to really take off and impact healthcare?
The paper highlights several critical ones. First, and maybe the biggest technical headache, was power consumption.
Still an issue today for wearables.
Absolutely. The paper calls it perhaps the biggest technical issue and performance bottleneck. You need these devices to be small, unobtrusive, yet run for extended periods. So the call was for further research in power scavenging techniques like that body heat idea, or harvesting energy from motion plus more efficient low-power radios, and just better battery technology overall.
Okay, power is number one. What else?
Security of private information, hugely important. You're collecting incredibly sensitive health data.
Can't mess around with that.
No. You absolutely need proper encryption and authentication mechanisms to protect that data during storage and transmission. Trust is paramount.
Makes sense.
Next, sensor miniaturization and efficiency. While sensors were getting smaller, many were still described as bulky or needed really precise placement on the body to work well.
Tricky for everyday use.
Right. So there was a clear need for improvements in textile sensors, weaving them into clothes, and just generally advanced sensor design to make them smaller, more accurate, and easier to wear correctly.
Okay. Power security sensors. Anything
Cool.
else major?
Yes, clinical validation. This is crucial for actual medical use. Prototypes are one thing, but for doctors to rely on these systems, they must be exhaustively tested and validated by professional physicians.
Got to prove they're accurate and safe in real clinical settings.
Exactly. Rigorous testing is non-negotiable. And finally, a really big picture challenge, standardization and cooperation.
Meaning getting everyone to agree on how things should work together.
Pretty much. The paper emphasizes the importance of interoperability. Different devices from different makers, different communication systems, they all need to be able to talk to each other smoothly. And that requires serious collaboration between researchers, doctors, manufacturers, hospitals, health organizations. Everyone involved needs to work together to build a cohesive ecosystem.
That sounds like a massive coordination effort.
It is, but essential if you want a seamless system rather than a bunch of incompatible gadgets. But despite all these hurdles, the potential described back in 2009 was just immense. The paper concludes that WHMS could truly revolutionize healthcare.
How so?
By providing these low-cost solutions for ubiquitous, all-day, unobtrusive personal health monitoring. The expectation was, and largely still is, that they'll enable early detection and better treatment of diseases, and also foster disease prevention and better understanding and self-management of chronic diseases. It's about empowering patients and shifting care models.
A move from reactive to proactive, like you said earlier.
Exactly. The authors even mentioned their own research group at the time was working on something called Prognosis. The focus there was on patient-system interaction and learning individual patterns. The goal was moving towards patient-specific systems, not just disease-specific ones. Truly personalized healthcare based on your unique data history. That's really the ultimate aim.
So we've really traced the arc here from the ambitious vision laid out over a decade ago through the clever innovations, but also hitting the very real practical challenges. It's quite a mix of high hopes and tough engineering problems identified in this foundational paper.
It really is, and it sets the stage perfectly for thinking about where we are now and where we might be going. So let's leave you with this thought. Imagine that future where healthcare isn't something you just engage with when you're sick, but it's truly proactive, constantly quietly working in the background, integrated into your life via this kind of unobtrusive tech. What new possibilities does that really open up? For your own well-being, for public health, and maybe just as importantly, how does our relationship with our own health data change when it's always there, always accessible? What does that future look like?
Something to definitely think about. Thank you for joining us on this deep dive today.